When going through medical school, I knew that I wanted to be in a community-based training program. That's something that stuck out to me, not only location-wise for Sacred Heart, but also the fact that this is a community hospital. It's a large community hospital.
If you come here as a resident, what you're going to get is to experience all aspects of internal medicine, from the simple, straightforward to the extremely complex. We have a large referral area, basically from Mobile up to Birmingham and over to Tallahassee. We have academic center pathology, academic center experience, but in a small, finite, one-on-one nature with specialists and general internists. You're not lost in a group of people. You are front and center. It drives you a little bit more to want to be there, want to be present, and know that you're going to be the one answering the questions and taking care of the patients.
The hands-on training that we receive here is phenomenal. We work one-on-one with our attendings, whether that be during our typical medicine rotations or any subspecialty rotations. We get experience with procedures as much as you want. If you want to be a very go-getter and want to do all the central lines you can in the ICU and you let your attending know right away, they will try to make it happen for you.
Our core faculty have been here forever. They're well-versed in what hospitalist medicine is. When the residents first get here, we partner them up with one of the 6 core faculty members. We match kind of personalities and likes. So whatever the resident is wanting, that's what we're going to gear their direction to be.
I had a wonderful mentor my first 2 years of residency while I was here. He was always one I knew I could come to for any kind of advice, whether that be medical advice, family advice. Our entire teaching faculty that we have on staff is always open and available. And even subspecialists, I know I can always just pick up the phone and call them if I have certain questions.
They have more specialist names in their cell phones that they can get a hold of immediately than I have in my phone. And you don't always have that in a large academic center where you're 3rd or 4th in line. Here, you go right to the attending specialist.
Once you kind of get into your own rhythm and find out, what works best for you, it becomes easier to then prioritize not only patients and patient safety, but your own well-being.
I think we do a pretty good job of allowing the time for people to go and enjoy things to do in Pensacola. The beach is here. There's lots of restaurants here. There's cultural things. Atlanta's about a 4-hour drive. New Orleans is about a 3-hour drive. Lots to do to kind of refresh and recharge from the health and wellness perspective.
This program has really pushed me to love and enjoy the aspect of hospital medicine. So I actually signed a contract to stay here at Sacred Heart because I love this place so much. This program, all in all, has really supported me and kind of fostered that growth for me to transition into being, alone in practice.
We really try our best to help everybody understand that nobody is a diagnosis, everybody is a person, and that's how you're going to get the best training and the best approach to people as you move forward in your medical career.
If you choose Pensacola, you are going to get a wonderful education. You're going to see a little bit of anything and everything come through these doors. Just because this is a community program doesn't mean there's any lack of pathology. You're going to get well-rounded training in both inpatient and outpatient settings, and you're going to be confident leaving Pensacola knowing that you have the skills to guide you forward in your career.